I want to take you on a journey that imagines we have an effective vaccine against COVID-19. What would that be like, and how could we achieve it? But our story doesn't start or end here. How did we get there? And more importantly, what's next? It all started months ago. Towards the end of 2019, a new strain of coronavirus was found to be circulating amongst humans in Wuhan, China. Person-to-person transmission resulted in a cluster of unusual pneumonia cases. This disease was named Coronavirus Disease 2019, or COVID-19. Within a very short space of time, aided by the globalization of trade and travel, this new virus spread rapidly across the world and was recognized by the WHO as a global public health emergency on January 30th, 2020. In the first steps to understand this threat, researchers started to work on the identification of the virus. It was found to be related to the original SARS coronavirus and the Middle East Respiratory Syndrome coronavirus, MERS-CoV. The new virus, SARS-CoV-2, is particularly well adapted to infect humans and is possibly 10 to 20-fold more infectious than the previous two viruses. It became clear that significant efforts were required to develop a vaccine for COVID-19 with unprecedented urgency. Research teams from all over the globe started working to develop protective vaccines against COVID-19. With different target antigens, adjuvants, and protocols, the race was certainly against the clock. Meanwhile, across the globe, healthcare systems were battling to save as many lives as possible, while a global pandemic was declared. Like other coronaviruses, SARS-CoV-2 causes respiratory infection. However, the presentation and clinical symptoms of COVID-19 vary greatly between patients. This virus is constantly creating new challenges for the healthcare workers on the front line, as every day we learn more about it and its potentially devastating effects. In laboratories, protocols and solutions are being created, tested, and optimized to improve the detection of infected people in order to stem the tide of the virus and prevent new disease. In the medtech industry, production must be ramped up to meet the needs of healthcare systems during a global pandemic. Meanwhile, governments are trying to manage the crisis they face today while planning for the future. This includes vaccination preparedness. It is not just about the vaccine, it's also about being ready to give it to the right populations to maximize coverage during the first weeks and months. So imagine we have it. A working vaccine. Now, a new challenge is in front of us. The logistics of a vaccination program must be coordinated at every level of the pandemic. In cities, in regions, in countries, in continents, in the world. Thinking about at-risk populations like the elderly, people with diabetes, patients who have had transplants, frontline workers. This is a giant undertaking, but it is necessary to maximize immunization coverage. The first wave of the pandemic may have passed, leaving in its wake extraordinary human and economic loss. The whole healthcare ecosystem is now involved in preventing COVID-19 from becoming a seasonal mass killer by producing a constant flow of vaccines to ensure a stable level of immunization on a global scale. This is an unprecedented challenge. But we are getting prepared for the future.